A lot of symptoms with bowel cancer can occur in other conditions as well. So some of the symptoms are not necessarily specific to bowel cancer, but rectal bleeding is one of the most well-known common symptoms that people mention, especially if it's associated with changes in your bowel habit towards looser motions. Tends to be in the older age group, but again, age is not a criterion in itself. We do see patients even in their 30s or 40s, unfortunately, being diagnosed with bowel cancer, though the mean age across the whole population is in the much older age group, around the 70 years mark. There are other symptoms where like a lump in the tummy, for example, if you can feel a lump in the tummy, or a lot of weight loss, or anemia. These are all symptoms that could potentially mean bowel cancer. But I don't want to alarm anybody. A lot of these symptoms can also mean very simple other problems. Bowel cancer, yes, bowel cancer can be treated and very effectively treated. And in the majority of cases, if it's caught early enough, if it's caught at an earlier stage, then it can be cured. In other words, the disease can be eliminated and the risk of recurrence would be very, very low. But that all depends on how early in the stage of the bowel cancer the diagnosis is. Sooner we get it, the sooner we can help help the patient more effectively. Well, the main crux of treatment for bowel cancer continues to be surgical. If you can cut out the bowel is a long tube, obviously, and bowel cancer, when we talk about bowel cancer, we're talking about cancer of the large bowel. Now, if a section of the bowel is damaged with this cancer, the best treatment, if it's caught early, would be to remove the cut section, remove the affected part of the bowel. And depending on where the tumor is, and depending on a lot of other factors, the surgeon can decide whether the bowel can be rejoined or whether a colostomy or an ileostomy. Ileostomy is like similar to a colostomy, but in the small bowel, a stoma needs to be formed, which can be temporary or sometimes permanent. But that's the mainstay in terms of treatment, is to cut away the tumor, surgical. However, there is a lot of other things that can be done, and there are lots of other things that need to be done depending on the stage of the bowel cancer. Sometimes, depending on where the tumor is, some patients may benefit from having some treatment before the surgery to kind of shrink the tumor down, make the surgery that much more likely to be successful. This kind of treatment can be radiotherapy or chemotherapy or a combination of both. And then, depending on the stage of the disease and depending on how advanced the disease is or how aggressive the disease is, once the surgery has been completed, then the patient may need to be sent for adjuvant treatment. In other words, supportive treatment afterwards, which is usually chemotherapy. There are lots of new modalities being discovered and tried as we go along, almost on a weekly basis. There's something new coming along in terms of immunotherapy or in terms of genetic understanding of how genetics plays a part in this, etc. But the bulk of it can be treated surgically and with some treatment either before and or after with chemotherapy or radiotherapy. I get asked this question sometimes by patients in the clinic, and I often tell them that, especially if it's a crowded clinic and especially if things are in a busy hospital, I say to them that when you're sitting in the waiting room waiting to come in, you saw other people sitting there. Could you tell how many of them had bowel cancer by looking at them? Could you tell how many of them have got a colostomy or an ileostomy? I said, I couldn't tell you if I walked in there, unless it's a patient I have personally dealt with or personally operated. In other words, once you've had the treatment for the bowel cancer, life can be, as people can go swimming, they can go dancing, they can go mountain climbing, they go back to their normal lives. And as I said, even the surgeon or a specialist nurse or a specialist doctor would find it difficult by just looking at them when they're walking around shopping, that they've had any kind of major surgery. Obviously, the surgery itself, you would need to be admitted, but we do a lot of, almost all the operations I do these days is keyhole surgery, laparoscopic surgery, which gives you, and we have enhanced recovery protocols, which allow patients to be discharged 2 or 3 days after the operation. Whereas before it used to be stay in hospital for 10, 15 days sometimes, depending on the major, certainly a week or more in the old days. So all of these things, but internally it's still a big operation. Patients still need to recover, the body needs to recover. It usually takes a couple of months for them to start getting back to their normal activities. Okay. If they do have chemotherapy after that, obviously, that will take several months of treatment, usually on a cyclical fashion. The chemotherapy is given for a few days, and then a period of rest, and then another cycle and another cycle. But those can sometimes have side effects. But again, majority of those side effects patients can cope with. And once they finish that, they can carry on with normal life. I expect patients who've had a keyhole surgery for the actual removal of the bowel cancer to be sitting out of bed the same day, a few hours after the surgery, eating and drinking and walking around the ward, the hospital by the next day, and home usually within 2 or 3 days after surgery. So that is recovery. However, if we talk about them recovering to be able to go back to their original life, that to a certain extent will depend on what they did in their previous life. If they sat in front of a computer and worked in front of a desk, that would be very different to somebody who's a manual laborer or somebody who's using, sitting in the no access to toilets or whatever, if they've got a job where. So ultimately, it also depends on individual patients. We all recover differently from the same kind of common ailments. You just need to look at COVID, for example, what it has done around the world. Some people don't even know they've had it. Others have died from it, and others are debilitated with long-term symptoms. So it's the same illness, but individuals will recover differently, and also the definition of recovery. But by and large, the vast majority of patients recover from the operation. There's a lot of information on this, and we've got our own website, the colorectaleducation.com website, where we've got lots and lots of personal experiences shared by patients of all ages and both sexes, different kinds of walks of life, sharing what it meant to them to have this devastating diagnosis landed on their head, and how they coped with it, and what life has meant to them after that.